Hello, my name is Dana Sear, and I'm currently a second year student at Texas Tech studying nursing. In today's presentation, we will be going over the topic of the lack of funding for childhood cancer research. More specifically, going to be discussed later in this presentation, are real stories of children who have been affected by cancer, and how the financial aspect of treatment affects families of the diagnosed. Along with these discussions, we'll also be talking about what needs to be done to push for an increase in funding. I'd like to advise you, before we start, some of the topics and discussions may be upsetting or hard to hear, but please note that this is the reality for patients and their families. When titled more than 4%, we're referring to the number that childhood cancer research receives. We're going to be looking at the effects of the lack of funding. But before we begin, I'd like to introduce myself a little bit more so you can know me a bit better. As I said before, my name is Dana, and I'm a full-time student at Texas Tech University who's starting her second year. I'm studying to become a pediatric oncology nurse, which is a nurse that treats and sees children with various types of cancer. We also see children with blood disease and a lot of variety, but mainly we see cancer patients. Currently, as of right now, I'm a pediatric hematology and oncology patient care technician. We do get a lot of patients, a lot of inpatients, meaning some of our patients have been here for 100 days, very long time. So we sort of develop these really special bonds with them. Before we move on, I'd like to introduce you a little girl named Eliza. She is the reason that I do what I do, and she was a major motivator in allowing me to become so involved in becoming an advocate for pediatric oncology patients.
I'll drop and speak a charm, take the weather from your heart and the weight from on your toes. And there's nothing to your side for you to recognize. It's honest long ago. The lake will overflow, flood all I've ever known.
So that is Eliza, and that video makes me smile, cry, be angry at the world for so many different reasons, and I'll explain exactly why. This is Eliza. This is her story. Eliza's journey began in 2019 at the age of 10 months old. She was diagnosed with a rare and aggressive form of cancer known as ATRT, or the technical term is atypical teratoid rhabdoid tumors. In short term, this is a very aggressive and rare form of cancer. Her mother and father, mother's name is Kate, and her father, Chance, began documenting her journey through a social media platform known as TikTok, and created a fan base of nearly 6 million people. That is how many people that this little girl impacted. Chance's account, called Hey Eliza, was gestured around the special bond that Eliza shared with her parents. It captured Eliza's high-spirited, funny, and loving personality, as you could see in that video. She was full of life. However, in April of 2021, Eliza's family received the news that her cancer had spread. And by the doctors, there were thousands of ATRT seeds that were located in her right lung, diaphragm, and heart. They were told that they may only have a few weeks to a few months left with their daughter. And nearly 2 months after receiving the news, on June 20th, 2021, Father's Day, Eliza passed away at the age of 3. At one point, Eliza hit remission, which means that she was detected as cancer-free. Eliza rang the bell to signify her accomplishment and that she was so strong. And a few days after she rang the bell, they received the news that her cancer was, in fact, still there. As we look into the perspective of this issue of funding for childhood cancer research, when it comes to the percentage of funding dispersed to childhood cancer research, or any research in that matter, a large factor in the amount of funding that is received is primarily based off a decision that is placed in Congress's hand. Did you know that during the 2020 fiscal year, the budget for the entire year was $4.79 trillion? This is for healthcare, this was for infrastructure, this was for NASA, this is for development. Anything that is funded by the government was included in this $4.79 trillion budget. And out of this $4.79 trillion budget, only $6 billion was given to the National Cancer Institute. Of this $6 billion, only 4% was given to children, which brings the amount to about $240 million. And to make this make sense as to why this is nowhere near enough funding for the year, the cost to produce and research one cancer drug, just one, is $648 million, just for one. That's almost 3 years worth of funding from the government. And there's also a reality. The truth is, although that you may not see it every day, people like myself and other healthcare workers who witness the struggles of cancer diagnosis firsthand understand the importance of needing support mentally, emotionally, physically, and financially. There's a reason that we see so many families starting GoFundMes for assistance with medical bills, housing, meals, household bills, and transportation. Discussion of being able to afford treatment should never be a factor in families making decisions on treatment for their children, on whether or not they're going to receive it or not because it's too expensive. Families should not have to worry about anything other than their child. When a family undergoes a cancer diagnosis with their child, many experience a financial burden from costs that quickly add up. And these can be things like parking fees, which usually are about $9 a day. And if you calculate that and your child has been in the hospital for 90 days, that's a lot of money. They have to pay for meals, they pay for their household bills, and in some cases, funeral costs, which can range from $6,000 to $8,000. Many of these families have to watch their children undergo intense treatments, mainly with the hope that it will be successful. Because in some cases, the very treatment used to treat them is what kills them. This is because the treatment options are mainly limited to chemotherapy, is radiation, which has its whole aspect of side effects, both short-term and long-term. And of course, surgery, which can only do so much for certain types of cancers. We shouldn't be losing 1,800 children to cancer every year. So how can you impact this? As we've gotten this far in understanding what impact the low amount of funding on childhood cancer research, I hope that you are able to see the struggle, the anger, and the fear that pediatric cancer patients and their families undergo during one of the most horrific journeys of their lives. As an advocate myself for these patients and their families, I ask that you take time to reflect on what changes can take place, how you can improve the lives of the patients, and be a part of something life-changing. This funding isn't just a discussion of money, but it's a matter of life and death for the children that are meant to shape our future. Future engineers, scientists, farmers, doctors, nurses, and even researchers. With your help, we can find a cure and eliminate the fear that comes along with a cancer diagnosis. The fear that a mother will have thinking about planning and attending her baby's funeral. a sibling who watches her brother deteriorate before her young and innocent eyes, or even a patient who knows that their life has all of a sudden become something so fragile that the very medicine designed to treat them could kill them. You may be asking, we increase this funding. What are going to be the results? What are we going to see from this increase of funding? How is it going to impact and affect families and patients and cancer research as we know it? So in the case of the funding is increased from 4 to 8%, some of the big things that we would see is a better understanding of cancer cell growth and development. So a lot of the biological things that we see with cancer. How are these cells forming? What do they react to? What do they don't react to? What makes them grow faster? What slows their growth? What destroys their growth? What stage of growth are they in? All of these are questions that can be answered through research. We will also see advancements in cancer prevention and detection. We can detect cancers earlier. We can find better medications that can be used to treat these cancers, let alone other diseases. This funding doesn't just impact cancer research, but by understanding all these different things, then we can relay this onto other diseases. Another result is a breakthrough in cancer treatment. So like I said, we possibly wouldn't be limited to just chemotherapy. You know, we could have medications that are targeted directly towards these different types of cells. And every cancer is different. There's not one cure for all of cancer. And that's because we have cancer in different parts of the body. We have brain cancer, lung cancer, breast, kidney, liver, stomach, lung, bone, blood, lymph nodes, everything. And each one of these cancers requires a different type of research. But we'll also see more productive clinical trials. I feel like our clinical trials are pretty minimal right now. A lot of them are just testing the water. Is it going to work? Is it not going to work? And that's not how it should be. There should be thought and development and testing done to make sure that these drugs are safe, to make sure that they aren't going to cause long-term side effects. So there's a lot that goes into it. We're going to see a higher quality of research on medications. But I ask you, Nancy Pelosi, as the Speaker of the House, to take initiative of making the change. This change would be to increase the funding from 4 to 8%, because in the end, these types of research could not only change our country, but improve healthcare, and it'll change the world and save lives. And oftentimes I like to think that, what if these changes were made prior? What if these changes were made a long time ago when we knew that childhood cancer research or childhood cancer was affecting people, and it was a big issue? And if only the change had been made for Eliza, maybe she wouldn't have had to pass away at the age of 3. Maybe she would be cancer free right now, and maybe she would be at the park every day, or starting school, or giving these kids a chance is what's going to make the difference. I hope you liked this presentation. I hope it encouraged you to want to take action on this issue and promote a change by bringing attention to Congress, by possibly, reducing funding in other areas that receive tons of funding, like NASA. Like to think, is it more important that we are able to live on another planet, or is it more important that we're taking care of things that are happening now here that we can have control over? So these are just some questions that I think are important to think about when making these sorts of decisions on funding. But that'll be it for today's presentation. Thank you for listening, and I hope that we can initiate change.